Hi guys. In the next few minutes, I will help you see full mouth rehabilitation through three things: the past COVID situation, a city scenario, and flow. But before that, please permit me to introduce myself as some of you may not know me. I'm a prosthodontist educator who helps female dentists see cases differently through my bioflow dentistry concept. And Smitadhara is my community where all of this happens. So let's dive in. Yes, COVID was one situation in the man's life where our life had come to a small halt. But did you notice the flora, fauna, earth rejuvenated and healed at a spectacular speed, which we never imagined? Also, the time of COVID was kind of a celebration for some people, but was a huge punishment for some people. I was amazed when it took such a huge, extreme situation for me to learn from this. What I learned was life depends on flow, not on structure. For me, it meant that people who found their flow during that time had fun, and those who almost lost their flow suffered. Let's take a lighter situation. Imagine a city. A city survives not on buildings, it survives on movements. The cars move, water moves through pipelines or a river nearby, air moves through ventilation, people travel, information moves, goods move. But if the traffic gets stuck, the city collapses. Even though the buildings are still there. So, again, life depends on flow. Yes, structures are important, but flow is the lifeline. Let's correlate it to us. In our mouth, the teeth are the buildings, and the saliva flows, air flows, forces flow, food flows, the muscles move, and the joints also move. But when this flow gets uneven, some tiny problems start: food lodgement, wear, teeth drifting, muscle imbalance, airway problems. These are not tooth problems, these are flow problems. And do you know why this flow exists? Flow exists because of differences. You may have learnt in your school life that winds flow from higher pressure to lower pressure. Electricity flows from a point of high electric potential to low electric potential. Yes, the same logic. So what differences are we talking about here? We have space differences because of which the teeth drift. We have force differences because of which teeth wear. We have airway differences because of which sometimes we come across mouth breathing with patients. We also have muscle differences. Sometimes the jaw tends to be shifted to one side. We have vertical differences, deep bites, open bites. Then we have left right differences in the form of midline shifts. We have plane differences in the form of occlusal cants. So when these differences are managed, flow exists. But when these differences are ignored, that is where the problem starts. And full mouth rehabilitation is not the start of dentistry. It is at a very later stage. Initially, this flow becomes uneven. Then the teeth wear, they may drift, then the bite collapses, then the muscles and joints may suffer, and then we may need to rebuild or reorganize the entire system. So, full mouth dentistry is not about crowns, bridges, implants. It is about restoring back the flow inside the mouth. So, dentistry is not just the science of teeth, it is the science of maintaining the flow within the mouth, and full mouth rehabilitation is a way to restore that flow back again when it is already collapsed. So get the correlation. Differences, flow. No differences, no flow. Blocked flow, disease. Restored flow, full mouth rehabilitation. And maintenance of flow is where Smitadhara is working. Thank you.